So let's get started.
Okay.
All right. Okay.
Well, I just want to welcome everyone. I see some old names and new names, and I just want to say thank you for joining us today. We're going to be talking about the difference between fat injections and filler injections. And if you have any questions over the duration of the presentation, feel free to send them to me via chat. Our presentation with Dr. Chaboki will last about 20 minutes. And then we're going to open up the floor to any open questions that you have. So don't be shy, ask away, and we have some as well. And I take it over to Dr. Chaboki. By the way, I will be muting everyone during the presentation. Thanks so much. Bye-bye.
Great. Thank you, Janet. So thank you for joining us today. And today's webinar, fat versus filler, a very common topic and question that patients are asking. My name is Houtan Chaboki. I'm a facial plastic surgeon here in Washington, D.C. And just a reminder, no photographs or video. This will be recorded so you can view this later. Standard disclosure, I have no financial relationships with any of these companies. A lot of what I use is off-label, and this is really just educational and opinion only. For those who don't know me, I always like to introduce myself. You know, I grew up in the Chicago area and went to undergraduate studying engineering at Northwestern and medical school at University of Illinois. Then went to New York at Mount Sinai to study facial plastic surgery, and then came and started practicing facial plastic surgery back in 2006. And our office is very close, walking distance to the White House. This is our team, and we can't do anything without our team here, Lauren, Rachel, and Janet, and you'll interact with them whenever you contact the office. So I focus on a lot of procedures on the face and eyes and nose, both non-surgical and surgical. But today's talk is how to rejuvenate the face with injections, whether it's filler or fat, or in some patients, maybe both. This is an example of a patient, and we'll get to her later in the presentation, who had filler in the past, but really wanted something longer term and natural. So she had fat injection. And these are results a few months after treatment. Who would want fillers or fat injections? Well, really the common concerns that patients come to us is that they say they look tired, they feel like they give the impression of having low energy, even though they're not. They may have dark circles or flat cheeks, just kind of looking run down, when in fact they're not run down. And a lot of what I do, whether it's surgical or non-surgical, goes back to anatomy. What is laxity, which is loose tissue and mostly involving the skin or muscle? Or is there a structural issue, meaning volume deficiency of the bone or fat? And some of this can be congenital, you're born with it. Some of this develops as we get older or develop some sun damage. A little bit of anatomy here. The areas shaded in pink in this example are the areas that are primarily involved with laxity. Things fall down, skin grows, is stretchy and loose. Eyebrows fall down, there's excess skin in the upper eyes, the lip becomes longer, jowls form, and a sagging turkey neck may form. These are typically treated with surgery where we're lifting tissue and removing skin. But for today's talk, we're going to focus on what happens with volume changes in the face. On the patient on the left, these are areas shaded in blue that there is volume loss. Fat shrinks, bone recedes, and this occurs in everyone to various degrees. The patient on the right, and shaded in yellow, there are some areas where there's volume gain. There's fat accumulation, eye bags, jowl fat, and neck fat. And fat and fillers are focused primarily in areas that we lose volume. So what's a filler? I mean, most people know what a filler is, but it's really made out of hyaluronic acid, a substance normally found in our skin. And there's several brands here within the US and throughout the world. And they all have their strengths and weaknesses. And the method of treatment is very easy. You come into the office, after a few minutes, we're done. And I look at it as a more focused rejuvenation, where we're adding filler, for example, along the jawline, under the eyes, in the lips. Fillers can be used alone, but often patients are coming in, they're getting some relaxer treatment for forehead wrinkles, they're getting fillers to enhance the cheeks or the lips, or they get a chemical peel. And fillers are not one and done, it requires maintenance. There's a buildup phase where we're adding fillers over a period of a few weeks or a few months, and then patients come every 6 months to a year, plus or minus, for maintenance. And we'll look at some examples in a second. Advantages, well, it's really a test drive. You can kind of see what something looks like before committing to surgery. And I view fillers like ice. We inject it and your body slowly dissolves it. But for whatever reason, if we need to dissolve it faster, we can't. There are other treatments I can do to dissolve it faster. It's less invasive, much faster recovery, and generally less bruising and swelling as compared to fat transfer or surgery. The other advantage is we can fine tune. If there's just a little bit of area we want to refine, then filler may be a better option. So let's look at some examples. First, I view the fillers or fat really in these kind of blue shaded areas. Here's an example of a patient before and after. At first glance, you may not know what was done, but she looks better. And that's what our focus is. We want patients to look at better versions of themselves and not different. And this is not one injection of filler, but a few injections of filler over time. And in this patient, we did it under her eyes, her upper cheeks, to reduce the shadow of her under eye area and to create a better blend of the lower eyelid and cheek. Here's another example. Similar situation where there was a buildup phase of a few injections over time to enhance the lower eyelid, the upper cheek area. And when you look in before and after, in this case, you may say, okay, she had something done to her lower eyes. But if you look at her just on the right, you don't necessarily know what was done. And that's our goal. We want you to look refreshed and rejuvenated, regardless of what treatment you do. Here's another example of a patient. And sometimes lower eyelid dark circles, or lower eyelid bags, or thin lips, or flat cheeks, while they can develop with time, some patients, it's congenital. It starts at a very young age. It just worsens over time. A very common area is the lip lines around the mouth and the smile lines. And we've all seen this, on the social media. Patients are getting fillers in the lips or in the smile lines. And this is an example of patients getting treatment in the smile lines. And often it may be one treatment, but again, these examples are 1 or 2, or maybe 3 treatments over time, to give you an idea. And fillers around the lips tend to last a shorter period of time because the lips move. Keep that in mind. Your metabolism may make a factor of how long these fillers last. Well, what about fat? Fat is a great option. We do it all the time, but I view it as more of a global rejuvenation. I'm not just injecting lips per se with fat. I'm injecting in one patient, under eyes, the cheeks, the smile lines, the lip, the chin, around the mouth, multiple areas at the same time to create a global rejuvenation. And while fat can be used alone, it's often combined with something else. So typically, I'm doing a facelift and I'll inject fat at the same time, or a neck lift or eyelid surgery to enhance those surgical results. Recovery is pretty easy, but there is more bruising and swelling with fat as compared with filler. But patients really don't have pain as much with fat injections. It just looks puffy and it settles with time. What are the advantages of fat? Well, it's natural. It's your own body. There's nothing synthetic. There's nothing manufactured or artificial. As a result, there's less risk of infection or allergies or delayed swelling. What's nice is it's potentially longer lasting. That fat, once it survives the transfer, can live with you and grow with you. And we're treating multiple areas at once. another advantage that's not well understood or well described, but it's a potential, is stem cells. There's certain tissue within the fat that when we inject it in the skin looks better beyond the actual just volume addition that you're getting from the fat tissue itself. So taking this, again, just an example of where we're treating the patient, let's take a look at some fat transfer patients. And when I say fat transfer, that also means fat injection or fat grafting or liposculpture. We are sculpting the face, but using fat as our medium. This is a patient who previously had filler, but was ready for something longer term and natural. And to me, this is when she comes in and we take photos, but this is in my mind's eye where I want to treat. And we have a conversation with the patient where we want to treat. In this particular patient, she needed a little bit more on her right cheek and right mid-face area, underneath her eyes, her smile line, her lips, and marionette lines below her lip. And this is her again a few months after treatment. Patients typically don't have pain or discomfort after fat transfer. We take fat from your abdomen or hips, and the whole procedure takes about half hour, 45 minutes. It takes a little longer as compared to fillers. Here's another example of a fat transfer patient. These photos are before her procedure. She also had other things done for her eyes and skin and neck. Well, this is the treatment area in blue zones that we reviewed together where we would put fat. Upper cheek, lower eyelid to blend the lower eyelid and cheek together, smile lines, and in her, a little bit more along the chin and crease below her lip. And this is her after treatment. She also had her eyes done and her neck done. But looking at the fat itself, it just enhances her face, gives a more apple cheek, and a more feminine appearance in her case. So what's the best? Well, if you know me, there is no one best. We like both. We like filler, we like fat, we do both. But generally speaking, those who have a more focused area that they want to treat, who might be a little younger, we tend to lean towards filler. Whereas those who have maybe skin laxity, they're planning a facelift or eyelid surgery, then we may lean more towards fat. But at the end of the day, it's a conversation we have with patients and we decide together what's best. Thank you. And I'll open it up to you, Janet, if you want to screen questions.
Can fat transfer ever be done in the office?
We can. We generally don't. Primarily because the fat transfer patients we've had have had other things done. And fat transfer, it's a little bit more uncomfortable than filler. So, patient safety is one of my primary concerns. So all the fat transfer patients we've done have had a little bit of sedation, and we've done it at a surgical facility, along with other, complementary procedures that they may be having, whether it's a neck lift or eyelid surgery.
Could you ever just do a fat transfer though?
Yeah, one of those patients that we showed, she had just fat transfer. She had filler before, didn't want more filler, and so we did fat transfer. It took about 45 minutes, an hour in the facility, and she was slightly sedated, and recovery was unremarkable.
Does the fat injection, the fat transfer that you do in the face, is it going to drop and leave those kind of fat gains in the areas that you showed? Is it going to show that more as you age?
Well, we're pretty conservative. The thing with fat is it's more unpredictable as compared to filler. It's living tissue. So we inject it and we hope it survives and lives and grows with you. Given that, we don't overfill or over-inject in anticipation that some of the fat may go away. What we haven't seen is fat moving. So we inject it in one area, we don't see it settling or moving to another area. Theoretically, it can. Realistically, we haven't seen that.
Does filler move?
Same thing, filler, we don't over-treat, we just kind of build slowly over time with filler. Theoretically, it can move after you inject, but we generally haven't seen it. The areas that it's most likely to move is in the lips, because the lips move, you're moving the lips. As a result, the filler can kind of move along with it. But with our techniques, we just haven't seen filler or fat movement after treatment. One of the biggest risks is they feel like they need more fat or more filler. So again, we stress that we're conservative, we'd rather undertreat than overtreat, whether it's with fat or filler.
So on the fat transfer, does transferred fat have any risk of dying off or going away? And I'm wondering, how does it get sufficient blood supply since it's injected into the new area?
Good question. So fat is living tissue, and when we inject it, we want that fat to live. So we're taking it from your abdomen or hips where the fat is getting a blood supply. When we remove it, we've disrupted the blood supply, but then we process it and inject it in such a way that we want new blood supply to come into the fat in the area that's injected. So as a result, we do smaller volumes. We don't do big volumes of fat injection in the face. And that's one method to promote vascularity to the new fat. But that being said, it also depends on the patient. Some patients may have had prior medical conditions or certain prior treatments, whereas the area that's receiving the fat is not as well suited to accept fat as compared to somebody else who doesn't have certain medical conditions or hasn't had certain treatments before.
So when it comes to fillers, how do you know what filler you should get? And does it blend with the fat that's there, or are you adding a new area to your face?
Yeah.
Kind of?
Yeah, good question. Very good question. So filler, every physician, every office will have their certain preferences. I don't have any financial ties to any company, so I use all the fillers. I use them in different areas of the face. But generally speaking, I have my certain preferences for fillers around the mouth and lips, and those around the eyes or the nose. And when we inject it, certain fillers will integrate better if they're maybe thinner. They may integrate better with your skin and fat in the areas that we inject. Other fillers that are thicker and stronger may not integrate as well, but every filler does have a certain degree of integration. All fillers will settle after we inject it. So we inject it, you'll see some result right away, but then it settles and integrates over the next week, 2 weeks or so after treatment.
And what are the complications between the fat transfer and what are complications in filler?
Yeah,
that
good
you
question.
could
Yeah.
expect?
Yeah, what we tell patients, the biggest risk with any cosmetic procedure, whether it's fat or filler, is you're just not happy with the result. You think it was too little, you don't see a change, or enough of a change, or too much. You look too different. You don't look yourself anymore. Those are the biggest risks. There is a higher risk of infection, lumps, bumps, nodules with filler. We haven't seen it, but it can happen. One of the risks with fillers is delayed swelling. So we do filler, everything is great. Then 6 months, a year later, you have an allergy or hormone issue or something else happens, and the area that had the filler may swell a little bit, get puffy. It's primarily a cosmetic concern and usually goes away or may go away with some treatment, but that's filler. The fat, same thing. The biggest risk is just not happy with the result. You feel like the fat has gone away. We don't overtreat with fat. We haven't seen an infection with fat, although it can happen. We haven't seen, there is more bruising and swelling with fat. So that keep in mind. And generally with any kind of surgical procedure, most of the bruising and swelling goes away within about a week to maybe 2 weeks. And we have examples of early healing after fat transfer on our website. I didn't include it here, but it's on our website under our blog if you look for it.
After you do a fat transfer, are you done? Is it kind of a complete thing, or do you have to do filler on top of it?
Very good question. So everything we do, even if it's surgery where I'm removing skin, it can be long-term, and fat transfer in and of itself is a long-term, but keep in mind your face and you are continuing to change. You will continue to lose volume and lose fat and lose bone. Your skin continues to stretch and loosen and sag. So when we do fat transfer, when I do fat transfer, it's not one and done, but it's one and maybe at some point in the future, you may want some more fat or filler. Filler, on the other hand, we know that you're going to come back within 6 months or a year to fine tune and maintain results. Fat, however, has a longer term results.
If you stopped using filler, what happens to your face?
Well, over time, that filler, your body dissolves it over time. Some residual may stay, but your face continues to change. Skin continues to stretch, fat continues to be lost, bone continues to be lost. For those who've had filler that want to switch to fat, sometimes we leave the fat as is and inject fat on top of it. Sometimes we will dissolve the filler and then do the fat. It really is on a case-by-case basis, but generally speaking, your face will continue to age as it would otherwise.
When you're looking at doing fillers or a fat transfer, are there areas that deem it more necessary, one or the other, of where you should start looking at it? Like, is it better when you're looking at someone's face to do more transfer at one time? If I just came in for under eye area, is that enough to do a fat transfer, or should I wait till more is needed?
Yeah, good question. A very good question. So if someone's coming to me with a specific need, under eye, smile lines, or lips, and they're not so much interested in a global rejuvenation, then I may lean towards filler. We can do fat in those patients. However, fat is generally, my general preference for fat is those patients who are open to the idea of multiple areas at the same time. So underneath the eye, cheek, smile line, around the chin, lips, because it's more worth their time. There is more bruising and swelling, keep in mind. So to go through bruising and swelling with fat transfer, we want to do everything at once. Whereas filler, there's less bruising and swelling. Filler is more of a kind of a lunchtime treatment. People come in before or after work, go back to work, So downtime is less with filler.
Mm-hmm. Okay. Once you have a fat transfer done, is it common to get it redone in the future?
It's not common in our office. Some plastic surgeons or plastic surgery offices may do it more often and more frequently. We don't view it that way. At earliest, we would do it at 6 months. Preferably, we wait a year, if not longer, before we consider another fat transfer. Keep in mind, when we inject fat, the fat may shrink for a period of time and then grow later. So we wait 6 months to a year before we consider another fat transfer. Now, during that time, if patients want a little volume enhancement underneath their eyes or the lips, then we could maybe supplement with filler in the meantime. But I wouldn't recommend multiple fat transfers in a short period of time.
Good. Is there ever a client who would not be someone who could get filler or a fat transfer?
Yeah, as with any cosmetic procedure, we look at the entire patient, their medical history, their medications they're on, prior treatments they've had, their recovery time, their outlook, and so forth, risk, and And then we determine what's the best treatment. And some patients, they may not be a candidate for either. They may need some kind of lift, brow lift or eyelid surgery to remove skin, or chin augmentation with an implant, or neck liposuction, or something else completely. And that's what the consultation is for. We analyze the anatomy, we'll analyze the neck and face, and come up with a treatment plan based on the entire person.
Okay. Well, Dr. Chaboki, thank you for answering our questions. And I want to thank everyone for joining us. If anyone has a last minute question, feel free to ask away.
Right. Well, thank you for everyone who joined us, who are watching this video now or at some point in the future.
And I welcome everyone to look for our next seminar, which will be in June, around June 10th. So it'll come out in our newsletters, and we look forward to seeing you there again.
Sounds good. Thank you, everyone. Have a great day. Bye-bye.
Bye.